Hello everybody and welcome to our webinar. Just to let everyone know, the webinar is being recorded. So to support your privacy, we have disabled everyone's microphones and cameras. However, the chat is available if you have questions, and our team who is with us today will answer what they can, and we will review everything at the end. So once our presentation is complete, we will send out a link to the recording in a follow-up email. So my name is Sam, and my colleague Stephanie is also with me. We are practice optimization specialists with Healthquest, and we will be presenting today. So we will be discussing various communication tools that allows you to share information to other healthcare providers. So please note the tips and tools shared in this webinar are for demonstration purposes only. While they may align with your clinic's workflow, they are not taken from any specific clinic. This webinar showcases options available to all Healthquest users. And all demonstrations are using a test database and test patients. No live patient or provider data will be shared. So today we will review CII and CPAR, what it is, who can use it, and the benefits of this pathway to your practice. Patient summary, what it is, how to use it, and what information can be uploaded. And finally, eReferrals, what it is, how it works, as well as a sneak peek at the future state. So now I will pass it over to Stephanie to get us started.
Thanks, Sam. So the first topic we will go through today is CII-CPAR. This stands for Community Information Integration and the Central Patient Attachment Registry. So what is CII? It's the Community Information Integration, which is a secure electronic pathway enabling two-way data flow from clinicians' community EMR to Netcare. It's been around since 2017. CII can be utilized by family providers, specialists, and allied health to share important patient information with any other healthcare providers that the patient may encounter. New features that make use of this pathway have been added over time, supporting innovation, increasing clinic efficiencies, and enhancing the patient's health journey. CII can be used for practice improvement plans, or PPIP, and we can post the link in the chat if anybody is interested. So who can sign up for CII? Family providers, including general practitioners, family medicine doctors, nurse practitioners, and pediatricians. Allied health providers like dietitians, respiratory therapists, registered nurses, pharmacists, and more. And specialists or consulting physicians. I do understand that pediatricians are not necessarily family providers. They fall into both the family provider and specialist categories for feature inclusions, depending on if they exclusively provide consults or if they're paneling patients as well. So CII features. As you can see from the table here, a lot of features overlap between the different roles, but there are some differences. Only family providers receive e-notifications. If a pediatrician is paneling patients, they will receive e-notifications as well. Pediatricians are able to send consult letters, while family providers will upload a CED report instead. If the pediatrician is paneling patients, they can be configured for CED submissions as well. Patient summary submissions can be done by family providers and specialists. Allied Health can submit these also, but only registered nurses and providers with PRAC IDs can submit. E-referrals can only be sent by family providers and specialists, as a PRAC ID is required for submissions. And uploading of test reports is an additional feature available to interested clinics. Please discuss this with your account manager if you're interested. And CPAR. So CPAR stands for Central Patient Attachment Registry. Its purpose is to identify the relationship between patients and their primary provider. Both family providers and pediatricians can sign up to participate as they both panel patients. Every month, your patient panel will automatically upload from Healthquest to the data repository. In return, your clinic's panel administrator can download or access 2 monthly reports, one on demographic mismatches and one on patient attachment conflicts. The demographic mismatch report includes patients who've passed away and any patient whose demographics do not match the provincial registry or their Alberta healthcare information. Patients on this list do not count as part of your CPAR panel, so ensure that you're working to clean up these mismatches on a regular basis. The attachment conflict report lists patients who are paneled to you who also have confirmed attachment at other primary care practices. Starting on April 1st, 2026, if you're participating in PCPCM, these conflicts may affect your panel payments. Once you've had a patient confirmed on your CPAR panel, you're listed as the patient's primary provider in Netcare. If your patients are seen in the emergency department, have a hospital admission, or day surgery, you'll receive e-notifications under your lab/report section in the patient's chart. Patient Summary, or PSAB. The patient summary is a standardized collection of clinical patient data curated by the provider and uploaded to Alberta Netcare. It's a collaboration between Alberta Health, Canada Health Infoway, Alberta Medical Association, and Alberta Physicians. Healthquest is the only EMR in Alberta to be fully conformed to support PSAB submissions. To utilize this service, providers must be signed up for CII-CPAR, as it's the transmission pathway for these uploads. Providers can share valuable information with other medical providers that could not previously be uploaded to Netcare. Submissions are done manually by the patient's provider, but the work can be supported by your team. You can choose what information is important to share and only make updates if more information becomes available or if there are status changes. Submissions do not need to be done at every appointment. Pick and choose the most appropriate time to complete the uploads, like at a complete physical or a meet and greet appointment. Support continuity of care by sharing EMR information with other healthcare providers. So I'll now show you how this works in Healthquest. To get started, we'll review the curation window. To find it, go into your charting window and the buttons right below your Netcare button. The curation window is where you make the selections for the information that you'd like to upload about the patient. Each curation window is unique to that patient. You can use the Select All checkbox to grab all items or deselect everything. You can then choose specific items to share. To help with uploads, you can delegate a staff member to review the window and make selections. Any selections made will save in the window and will be available when you, as the provider, open the window. Each section of the window has a notes field. This is used to provide context or additional information. If you record anything in this field, it does not automatically populate into the patient's chart. You'll need to also record it elsewhere. If there is a section of the summary that you don't have any information available in or don't want to send, use the empty reason to provide a reason why no data will be shared. Let's go through each tab where the data is coming from. So the first section that we have is the medication section. This area shows every prescription that the patient has ever been provided from your clinic. Pick and choose the ones you'd like to share and use the notes box to provide context, like adverse reactions or off-label usage. Next, the allergies section. It shows anything recorded in this allergies area of the patient chart. Data shared includes the allergen, how long they've had the allergy for, the type of allergy, and the severity. Problems pulls from the patient's problem list. Data shared includes the problem name, the severity, the status, the start date, and the diagnostic code if recorded. Your vitals section will pull information from any chart note that you've recorded vitals in. This includes height, weight, BMI, and blood pressure. We can also share length in children under 2 and their head circumference. Healthquest has created 3 charting templates to support uploads for the remaining 3 categories. The charting templates have automatically been loaded into everyone's Healthquest. To find them, click on the New button to open a new chart note, and they're listed right here. So PS family history, procedure history, and social history. I have existing copies of these ones in this patient's chart, so I'm just going to right-click on them from the overview to open. The first one that we'll look at is the procedure history. The procedure history template is used to document any surgeries or procedures that the patient's being referred for, completed, or canceled. Use the notes box at the top of the chart note to record information regarding the patient's surgical or procedure history. In the lower section, record any of the procedures or surgeries that have been completed. You can document the date that it was completed, the name of the procedure, the follow-up date, and any results or notes that you'd like to share. Use the Add button to add additional procedures. Next one we'll look at is the family history. So the family history template is for recording chronic health conditions that affect family members of the patient. Use the notes box at the top of the chart note to record general information regarding the patient's family. Use the Add button at the bottom to add a relation to the patient with the diagnosis that they have, using one line per health condition. The information that you share includes the relation to the patient, their diagnosis, age of onset, and if applicable, their cause of death, and the age that they passed away. Use the notes box to provide additional details on the diagnosis or relation. The family notes field can be used to provide additional information about this specific relation. And the last template is the social history. This one looks a little bit different compared to the other two. It is for recording lifestyle or social history items like tobacco use, alcohol use, exercise, illicit drugs, living situation, or any other items that might impact the patient's health. The social alert and journal note fields can be used to provide general information regarding the patient's social history. The additional notes field will populate data into the notes box in the curation window. As a provider, you can review or update the selections, and once ready, click the Send button to submit the patient summary. Use the Send Cancellation button to cancel the submission. There are a few additional features available within the patient summary curation window. The first one is this View Report button. It launches a report that provides statistics regarding submissions that have occurred within a certain date range. It can generate information for all providers in the clinic or for specific providers only. The View History button. If you click on this, you'll be able to view the submission history available for the patient. You can see what items were submitted and when, and by which provider. The Security Log button. You can use this to change the patient's confidentiality permissions. If the patient doesn't want their information shared to Netcare, mark the patient as externally confidential. This will stop CEDs, letters, and patient summaries from submitting, but the patient would still count in your CPAR panel. So I'd just like to go through some examples of when it would be great to submit a patient summary. The first one would be if you've got a patient with a language barrier who may have a difficult time sharing information about themselves in a hospital or ER setting. Or if you've got a patient who's arrived from another province or outside Canada, share their medical history, which would not exist in Netcare otherwise. Or if you complete in-office procedures like minor surgeries or IUD insertions, share the date these procedures were completed and any notes that may be beneficial. I always like to think of it like this. If your patient presented unconscious to the hospital, what kind of information would you want to share on their behalf? So the CED versus the patient summary. I'd like to go through a comparison of the different data shared between the CED and the patient summary. There is some overlap, but there are also some differences. Both the CED and patient summary upload the service provider and delivery location, or your clinic's information, health concerns or problem list, and allergies. Only the CED uploads the reason for the visit or concern, immunizations provided in clinic, and referrals made. The patient summary is the method to share medications prescribed, procedures or surgeries, family history, and social history. Both the CED and patient summary will upload observations like blood pressure, height, weight, oxygen saturation, and head circumference, while the CED uploads pulse and the patient summary uploads BMI and length on children under 2. So that's all I've got regarding patient summary for today, and Sam is going to present on eReferrals.
All right, so moving on to eReferrals. eReferrals is all powered by Community Information Integration, the CII. CII enables secure two-way communication between your EMR and provincial systems like Netcare and Connectcare, ensuring the right health information is available when and where it's needed. eReferrals allows you to electronically send referrals with the click of a button, so no more faxing. Healthquest, Canada Health Infoway, and the Government of Alberta had collaborated to initiate eReferrals, which is integrated within your Healthquest. eReferrals is currently set up for the FAST program, Sharp Adult GI, and K Edmonton Clinic Urology. So the benefits to using eReferrals: is you have immediate confirmation the referral has been sent and received. Referrals get sent to the most appropriate specialist based on the reason for referral and the specialist's shortest wait times. Uses existing referral management functionality. And it's easy to learn for providers and staff. So from here, I am going to go into a demo. So if I open up my Healthquest, I'm in a patient's chart. I'm going to start with the provider's perspective. So I'm just going to right click on an existing letter that I have ready to go, just to save a little bit of time. So as a provider, once you've generated your letter, instead of clicking save, we're going to click new ref. And I have a pre-built referral template, so it defaults to pending, low, and I have it assigned to the job class for referral coordinators. As a provider, you're the referring practitioner, you will automatically populate in here. And then I just need you to fill in the reason for referral. So in this case, we are talking about shoulder pain. So I'm going to start typing in the reason referral, and you can see I'm getting some options available. If you use the drop down, you can see multiple options. So you can select from here, or you can click this magnifying glass to the right of this drop down. It's going to open up a search box, allowing you to search the reason or the specialty, which would then give you a list of options available. I'm going to click shoulder pain. And once I've selected a reason for referral, the referral method has automatically changed to eReferral. As a provider, click save, and you will see that your letter is now attached. From the provider's perspective, you could close out of this and pass this over to the referral coordinator staff. So I am going to close out of all of this, close my letter and chart. And now I'm going to switch over to the referral coordinator's perspective. They would open up Healthquest, and on the right-hand side, referral management, they select that. It's going to open up their inbox for all of their referrals that they are following. So I'm just going to go through and find the one that I just generated. So here's my pending referral, Dr. Bonner for shoulder pain. You'll see here in this blue box, my requested specialty has defaulted to orthopedic surgery. Based on the reason for referral, if there's more than one option, for example, wrist pain, that could go to orthopedics or plastics. So the requested specialty would actually be blank. You would select those two options from the drop-down. The requested triage site, you can select from the drop-down the location based on geographic area. I'm going to select the Edmonton. And you'll see as soon as I've got the reason for referral, the requested specialty, and triage site, my send eReferral button appears. I'm just going to go through a couple of things before I go through sending the eReferral. Obviously, you've got the referring practitioner. They have to be live on CII in order for this to be to go through properly. The reason for referral, specialty, and triage site are all information from the health service catalog. So the health service catalog is part of the AH tables in Healthquest, and it is all of the possible combinations of reason, specialty, and site. So Healthquest updates that every night. So when edits are made to that each night, Healthquest will get the most recent upload. If we scroll down a little bit more to the bottom blue section, there's a patient contact notes and special considerations. If you have information regarding the patient that you feel is necessary to share with the specialist teams, such as they are hard of hearing and you want them to have that visible outside of the letter, you can enter that in here. Or if the patient is away for the next 3 months, because they don't like winter in Alberta. Completely understandable. You can enter that information in here. So then the specialists are aware that they won't be able to contact that patient during that time. There is an attachment. There's a referral letter here. There has to be a referral letter, else it will not go through. If you want to send supporting documents, obviously this is shoulder pain, you may want to send diagnostic imaging. You can click this paperclip and it's going to open up your attachment window. You can scroll through all of the options from the patient's chart, or you can select from the drop-down for a specific section to make it quicker. I'm going to do my CT for my right shoulder. I'm going to click add, and then I'm going to save it. Yes. So now you can see 2 entries for the attachments. The last thing that I will mention about this e-referral before I go ahead with the send e-referral button is you can see in the demographic information down here that the age of this patient is 15. So they are technically a pediatric patient. If there is a pediatric patient, in order for us to be able to send an e-referral on their client card, you click the client card button here, it will open that up for this patient. They have to have on their relations tab a parent or guardian listed under the parent section. So in this case, I have a parent attached. If there is no parent attached, you would have to click new, look that parent or guardian up, and you can then select the applicable patient. If the parent or guardian is not a patient of the clinic, you do have to create a client card for that parent or guardian. So at the very top of the client card, you would click on new, and you would generate a new client card for that parent or guardian. You'd simply add in first and last name, address, and contact information, leaving everything else blank. No need for a PHN. Leave your default practitioner blank. They are not a paneled patient. They are simply there for the benefit of adding that parent or guardian to the pediatric patient. So back on the pediatric patient's chart on the relations tab, you would then go to parent, click new, then you would be able to look up that parent or guardian for that new client card you generated and click OK. Now that we have that attachment and we have everything else on this referral that is good to go, we can click send e-referral. Obviously, this being a test database, I can't physically send it. It won't actually go through. So once you click that button, you will see 3 immediate notifications. It was sent on what date, time, and by who. And you'll get a received by CII and received by e-referral within that same minute as well. You'll also get a referral ID number that is unique to this referral. So now that it has been sent, you would then at this point continue to track your referrals the way that you normally do. So my date referred, I'd right click and send it as today. I'd change my status to sent. And I can change my due date 2 weeks ahead so that I can then follow up to make sure that the referral has been accepted or declined. And then you would click save. So I'm going to go back to my PowerPoint here and just kind of go through a little bit about the future state for e-referrals. So looking ahead at the fall of 2026, at the future state of ERS, or electronic referral solutions, we will be introducing a more complete 2-way communication between the referring provider and FAST, or the central intake team, through all stages of the referral process. Phase 3 of the ERS We'll focus more on integrating specialists or providers receiving those referrals to support electronic information exchange. Additional ERS capabilities that are also under review include secure messaging, inclusion of specialty pathways, and e-consult functionality. So e-ordering is the broader initiative that includes not just e-referrals, but e-labs as well. In keeping with future state, with e-ordering, you can request consults, labs, and imaging, such as MRIs and CTs. Results will obviously automatically flow back to the patient's record, which eliminates paper, reducing follow-ups, and moving the need to chase down faxes. So this is not a new task. It is simply an electronic solution of the workflow you already use. So eLabs is something that we are actively working on to release in the future here for Healthquest. So that would then be the second piece to that e-ordering. That brings us to the end of our presentation here. So we can open it up to questions and comments if anybody has any.
We had a couple of questions in the chat.
Sure.
Do you still have your Healthquest up?
I do.
Okay. This one is, our referral letters come by faxes that we index. We don't make the referrals in our letters. Would there be a way to process a new referral from a scan versus a letter?
Great
So
question.
from the index files.
Yes. So when you are indexing your documents, it'd be in your index files document. When you look up your patient, you do your type the same way as that you normally do. It's going to do a referral letter. And you would click this Save with Ref button. So that would generate your new referral, as well as save it to the patient's chart. And then you would continue.
The next one that we have is that they don't have e-referral as an option in the referral method drop-down.
Perfect. So if you don't have that activated yet, you will have to use the link that I think Stephanie did for the eReferral sign up participation. If you click on that link, it will take you to a electronic form that would then get submitted to eHealth, and they will then reach out to you to set up a meeting to discuss the next steps for getting onboarded for eReferrals.
And then there's just one more here. So how would we be able to see what other referrals already exist for the patient? For example, if they went to another clinic for the same referral, to ensure we're not creating a duplicate. We can see this when we refer through Netcare. How can we see it from here?
It's a good question. And I'm not sure as I have the perfect answer for it. I do think that you can see these referrals in Netcare under the eReferral tab. I can't remember what it looks like exactly, but you should be able to see that in their chart on Netcare, in their profile on Netcare.
And then there's another one, would this service be included in our Healthquest contract? So this is not a service that we charge for, but you do need to fill out that survey and go through all of the steps to make sure that you're signed up appropriately for everything. And can we send CT and MRI also through eReferral?
So at this time, CT and MRI would not be going through eReferral. The eReferral is only available for the FAST programs and adult gastroenterology and Edmonton Clinic for urology. When it comes to sending CTs and MRIs, future state for eLabs, which would be the e-ordering section that I'd kind of mentioned, that's when you would be able to send those CT MRI requests electronically through there, but not currently through the e-referral process that I showed today.
Awesome. Thanks so much, Sam. That was the last one in the chat.
Perfect. So obviously, this would be our third webinar that we have done for Healthquest. So the next one is going to be in July. We don't yet have a topic confirmed. So if anybody has any ideas that you would like to see, definitely please let us know what you would like. You can drop it in the chat, or you can reach out to either your account manager or Stephanie and I, and let us know. And if you have any questions, here's the tech support phone number. If you don't have access to this link for the eReferral sign up, then and you can call into tech support. They will defer you to this eReferral sign up sheet. So just be aware of that. And last but not least, if you feel your practice would benefit from having somebody come out and help optimize your workflows, don't forget to reach out to your account manager as well.
And just before we sign off here, Sam, there was a question in the Q&A. And so they were just wondering if we can direct, or if they can direct the referral to a specific provider.
I mean, you would be able to document that provider name on the letter. And if you wanted to put that information in the special considerations box for the referral, I don't know from the FAST central intake team from that side of it, whether they would sort of honor that specified provider or whether they would still defer to the shortest wait time based on the reason for referral. I would have to check with the FAST team on that one.
Awesome. Thank you so much.
I think this one was a short and sweet webinar. So if anybody has any other questions or comments, don't forget to type it in the chat. If not, we'll give you a little bit of time back before you have to get back to work.
Have a great day, everybody. Thank you for joining us.